Demo of the AI Healthcare Scribe tool. In this demo, we'll be going through a mock GP consultation and how this tool is able to generate the desired summary of the consultation. As you can see, we could generate, for example, shorthand notes or a clinical letter. For the purpose of this mock GP consultation, we'll be generating shorthand notes.
Good afternoon, my name is Kashi, I'm one of the doctors. Please can I confirm your name and date of birth?
Hello, my name is Adrian Fletcher. I'm 45 years old.
Nice to meet you, Adrian. And what brings you in today?
Well, I've just had this cough for the past week or so.
Okay, and can you tell me a little bit more about this?
Yeah, it's just I've been coughing, feeling sort of generally a bit unwell as well, and the symptoms just don't seem to be going away.
Oh gosh, I'm sorry this is happening. Can you describe to me what type of cough it is?
Well, I think it started off, it felt quite dry almost, and I've noticed that more recently I've actually started producing this like yellowy substance.
Okay, and how much of this are you producing right now?
It's hard to say. I've just noticed it maybe a couple of days ago.
A couple of days ago. And is there any blood in that?
No blood, no.
No. And with this cough, are you experiencing any other symptoms such as a shortness of breath?
Not really too much. Yeah, sort of occasionally, I'd say.
Okay, and how occasionally is this?
It's hard to sort of quantify it, but
Okay. Anything which brings upon the shortness of breath of a cough?
nothing particularly.
No? Anything which makes the cough better?
Again, not that comes to my mind.
No. And have you noticed any chest pain?
No chest pain.
Okay. And any recent fevers?
Maybe like a mild one, I'd say.
And did you measure your temperature by any chance?
No, I've not measured my temperature.
And how long ago was this fever?
It's hard to say.
Okay. And is this cough and the shortness of breath affecting your daily activities right now?
I think, yeah, overall I've noticed my symptoms have been interfering with my activities and particularly my sleep as well.
Okay. And how is it affecting your sleep?
I'm just finding it harder to sleep, I suppose.
Have you ever woken up in the middle of the night gasping for air?
No, I haven't.
Or of your cough at night time?
No, not really.
And is there any particular times of the day where you're coughing more?
I think when I wake up, actually in the morning, I notice I'm coughing a lot more.
Okay. And have you noticed any sore throat?
Yeah, maybe a bit of sore throat, definitely.
And I've asked you a lot of questions. Do you have any ideas of what might be going on?
I don't know, maybe it's like a chest infection or like a bad cold or something. I'm not really sure.
Yeah, that sounds like a pretty reasonable idea. Is there anything in particular you're concerned about?
Well, to be honest with you, I'm almost a bit worried like it could be pneumonia or maybe like lung cancer or something.
I can understand why this is a concern. Just to ask a couple more questions. Have you noticed any weight loss recently?
No.
Nope. Or any long periods of fevers?
No.
Nope. Or any profound sweating at night time?
No.
Nope. And any changes to your appetite?
Not really, no.
And sometimes when people feel a little bit generally run down with a cough or a little bit of a shortness of breath, they don't eat and drink okay. Is that relevant to you?
I'm eating and drinking fine, but as I just said, like just my daily activities, like the cough, I think it does interfere a fair bit.
Yeah. And do you mind me asking what you do for a living?
I'm an electrician.
Okay. And have you managed to have to miss work because of the way you're feeling?
I've managed not to so far, no.
Okay. Well, if it's okay, I'm just going to ask some more questions about your past medical history. Is there any other medical conditions that you see the doctors for?
No, nothing.
No. And any medications you're taking currently?
No, I'm not taking anything at the moment.
Yep. And any allergies?
Yeah, I'm allergic to penicillin.
What happens when you take penicillin?
I get a rash.
Okay. And is this a whole body rash?
Yeah.
Okay. And just some questions about your family. Is there any medical conditions which run in the family?
Well, my dad actually had emphysema, I think because he smoked.
Okay. And do you smoke?
Well, not anymore. It's been a long time, actually.
And do you mind me asking when you smoked and how much you smoked?
Oh, I probably haven't smoked for about 20 years, so I smoked in my 20s, about 10 a day.
Okay, and how long was this for?
Um, about 5 years, I think.
Okay, and any alcohol?
Just social. I just drink socially at the weekends.
Okay, and any excessive drinking?
No,
No?
not at
Okay.
all.
And any recreational drugs?
No.
No. And who's at home with you?
Oh, I live with my wife and 2 children.
And are they experiencing any similar symptoms?
No.
They're currently fit and well?
Yeah.
Okay. And have you had any recent travel?
No, I've not been travelling anywhere.
No. And any pets at home?
No.
No. And any extreme mold at home?
No mold, no.
Okay. And everyone around you, no one else is having similar symptoms to you?
No, it's just me that seems to be having these.
And is there anything in particular that you're hoping from us today?
Well, just, help me figure out how I can make this cough go away. That's the main thing.
Of course.
Just want to feel better.
Of course, and we really want to help you. So I'm just going to take some observations from you and just have a quick listen to your chest, and then we can take it from there, if that sounds okay.
Okay, sure.
Perfect. Okay, so I've had a quick listen to your chest, and it sounds clear to me, and all your observations are within the normal ranges. So it's nothing I'm particularly worried about.
Okay.
And this, coupled with the way that you said you've been feeling with your cough, which is now producing that yellowy substance, and the little bit of shortness of breath that you're describing, it's all making me think that you have something called bronchitis.
Oh, okay. Oh dear. How severe is that?
So bronchitis is essentially a little bit of an infection of some of the airways in your lungs, and it's a very common condition that usually happens sometimes in the winter months, and it's something that we can easily help you treat, and it usually resolves by itself.
Okay,
Yeah.
That's good to know.
Yep. So it's essentially a condition which in a few weeks should get better by itself.
Right, okay.
What we do recommend is that you just, if you do ever feel like if you're getting a sore throat or a bit of chest pain from the profound coughing, you can take some simple painkillers.
So like paracetamol.
Yep, exactly, and that can really help you cope with the way you're feeling until the symptoms settle themselves and your body naturally fights off the infection.
Okay.
In the meanwhile, we do recommend that you stay adequately hydrated. It's really important that you give your body the amount of water it needs.
Right.
And rest, and don't exert yourself too much.
So should I be should I not be going into work?
Well, it's a judgment that you can make yourself according to how you're feeling. We recommend that you don't exert yourself too much and you give your body the time and rest it needs to fight off this infection.
Is it possible I could give it to someone else, in my family, or?
So there is a chance that it may be contagious and infectious. However, if you maintain adequate hand hygiene and you if there's anyone sick or currently unwell at home, if you stay away from them, usually in a few weeks it does resolve by itself, and it's a very common condition. Yeah.
I see. Okay.
Yep. Also, just some other simple measures that you think that we think will be helpful is if you think any cough syrups some patients find this effective just to help with the way they're feeling and soothe their throat. So this is something you could try yourself.
Okay.
Yeah. And so right now I don't think it's needed to give you any antibiotics right now.
Okay.
Just because I think your body is able to fight off the infection by itself, and it's seeming viral in nature to me.
Do you know how long it's going to take for the symptoms to go away?
So we presume in the next 1 or 2 weeks you'll be feeling quite better, and in the next few weeks your body will be able to fight off your whole infection.
I see.
But in the meantime, if you do feel like you're getting extremely short of breath, or you're getting a very acute fever, or you're feeling as if you can't breathe and you can't cope with the amount of cough, please do book an appointment in or visit 999 urgently.
Oh, okay.
Yeah. And I'll give you a follow-up call in around a week to see how you're doing and if there is a need for us to prescribe you some antibiotics and take a different route.
Okay.
Yeah, and I appreciate I've told you a lot of information right now.
Yeah.
If you want, I can write anything down, or I can give you some leaflets. And of course, you have our number. If you want to speak to me about anything else, please do ask any questions or book another appointment in.
Okay. That sounds good. Thank you very much, Doctor.
Perfect. Okay. I would just like to add my documentation for the observations. So his heart rate was 80, his temperature was 36.5 degrees, his resp rate was 16, his PO2 was 98%. Blood pressure was 120/80. Chest was clear on auscultation. No wheeze or crackles could be heard.
Okay, so that was the mock consultation, and now the Scribe tool is generating the shorthand notes. This is a process which usually takes a couple of minutes, usually no more than 2 minutes, but it does depend on the duration of the consultation itself. And so, obviously, for longer consultations, it would take slightly longer to generate the notes. However, the time for transcribing the audio and even doing the generation is always getting shorter and shorter as the AI models running behind the scenes get better. So this is definitely something that will reduce with time. So we'll just wait for these notes to be produced. Okay, now we can see we've got some produced notes in shorthand form. These notes are completely editable. So for example, if we see something that we want to change, we can very easily do so. And we can also see that most of the relevant details of the consultation have been accurately captured. So that includes things like spellings of medications, spellings of conditions. We see that the shorthand notes even use appropriate abbreviations. These are all things which can be customizable and tailored to the needs of the clinician. We see that the impression and next steps in the plan have been accurately captured, and furthermore, at this point, it would be very easy for the whole summary to be copy and pasted into the patient record software or saved locally on the device. None of the consultation data is permanently stored on the local device once the summary has been generated. So after we see this summary being generated, the consultation audio and transcript are all permanently deleted and not stored. At this point, we could save or discard the summary as needed. Thank you very much for watching this demo, and thank you for answering the questions that follow.